Today's topic of discussion embolism. What is embolism? The embolism is anything solid, liquid, or gas. Anything solid, liquid, or gas mass moving in the blood. The point of origin is something else. So, the embolism is anything solid, liquid, or gas moving the blood. So here see this diagram. This one is the blood vessels. Okay, this is thrombus. Still it is attached wall. Okay, so it's thrombus. This one, okay, get detached. Detached. Not okay. This one not thrombus. It is moving freely, so we will call it this one is embolus. So this solid or liquid or gas mass attached to that blood vessel's name is called as thrombus. Okay, what is thrombus? Clot without injury. So this one now detached, then moving freely moving to that blood. This one name is called as embolus. It may be solid or liquid or gas. The three things, it is a mass moving freely into blood to other organ. So imagine the wall of blood vessels. This is thrombus without injury. It is formed. The clot without injury. It is a thrombus. So till it is attached. Okay, so it have that name thrombus. Once it get detached and start freely moving here, it is no more thrombus. Now it is called as embolus. Now it is called as embolus. So embolus, it can be solid, it can be liquid, or it can be gaseous. Okay, gaseous mass. It can be any mass moving freely in the blood from one point to another point is known as embolus. So this thromboembolus is the one of the type. Some other type also is presented. What are the other type of embolus? Depending upon that matter, it may be liquid or soil or gas. First classification. Second classification based on the infected or not, whether microorganism presented or not, based on that. Third one is sources of emboli. Fourth one is flow of blood. Okay, so based on these four characteristic, we have four different type of embolus. Now we will discuss one by one. So first one is depending upon that matter in the emboli, it may be solid or liquid or gaseous. In solid embolism, the thrombus, once it detach, it is a solid embolus. So it is have that name thromboembolus. The solid is the example. Solid example is thromboembolus. Second one is liquid. Liquid example amniotic fluid embolus. In that liquid embolus. And fat embolus. Fat embolus also liquid embolus. Fat also liquid embolus. Then gaseous embolus can be there. It can be solid, it can be liquid, or it can be gas. It have three type. Okay, so solid thromboembolus example, liquid fat and amniotic fluid, gas example air. So second classification, whether it can be infected or not, whether whatever embolus are there, does it containing bacteria inside them, or does they are sterile? If they are sterile, is named as plant. Plant. If they are infected with bacteria, they are septic. They can be two type, whether they are presented in artery or vein. If they are presented in artery, they are arterial type. If they are presented in vein, they are called venous type. So here bacterium presented means septic, sterile, no bacterium, no microorganism means bland. So based on either infect or not, two classification. First one is based on the material, whether liquid, soil or gas. Second one is based on bacterium. Third one is venous sources, whether it may be arterial or it may be venous. Cardiac from left side of that heart, then lymphatic emboli. Predominant arterial and venous emboli. So last one is depending upon the flow of blood. Okay, can you see this diagram? Where are the organs? Where are the organs here? Okay, you can see that arterial supply, arterials, this one is the arterial wall, arterial supply, supplying pure blood and venous drainage of that organ to SVC and IVC. Impure blood is carried by the vein where it is, where that embolus. See here, this one is the embolus. Embolus, it can be artery or it can be presented in vein. So yeah, that embolus, it can be presented in this artery or it can be presented in this vein. Imagine if that embolus is presented in that artery, so it is presented in this artery. What will happen? That arterial blood flow is obstructed. Arterial blood flow is obstructed. Here obstructed because of embolus. That organ will not get pure blood. So this organ will not get pure blood because the artery is obstructed. It will leads to ischemia of that organ. So here obstruction will happen. So here it will causes ischemia of that organ. If that embolus is presented in the artery, if that embolus is presented in the artery, so streaming of that organ, if that organ is heart, you suppose that organ ischemia formation, we know artery obstructed means ischemia or infraction. If that organ is heart means it will causes MI. If that organ is brain means it causes stroke. If that organ is lymph means it causes gangrene. It can be intestinal gangrene. So depending on organ to organ, basically it is ischemia. But what happen if that embolus are presented in this vein? Here vein is presented means what will happen? What is the consequence? What will happen? Here embolus, this embolus will go to this vein. Okay, go to this vein. It will keep on moving here. Okay, all the vein, where does it go? Any vein of human body. Okay, that embolus will move to SVC and IVC. It will move to right auricle. So right side of that heart, it move to the right ventricle. From that right ventricle, this embolus will go to pulmonary. Okay, it will go to pulmonary artery. From pulmonary artery, it will go to pulmonary capillaries. So here this capillaries presented, it will move to pulmonary capillaries and block there. So here it causes block. So basically it will cause pulmonary edema. So all the venous embolus leads to pulmonary edema. So here two things is important. All that artery, this artery here, this artery leads to ischemia or infraction. All the vein, it leads to pulmonary edema. So it will that embolus will moving SVC, IVC, right article, right ventricle, then pulmonary, okay, pulmonary, then pulmonary, it will reach to pulmonary artery and capillary. In capillary only it leads to blockage. So basically it causes pulmonary edema. So now we'll see various type of embolus one by one. All the artery one leads to ischemia. We knows all the artery leads to ischemia or infraction of that organ. If that limp, it causes gangrene, heart, MI, brain, stroke, then stroke and death. Effect of venous embolism, that obstruction of pulmonary artery circulation leading to pulmonary embolism. Venous one lead to pulmonary embolism. So starting here it is keep moving, keep on moving, keep on moving. Right side the heart, right article, right ventricle, then it will go to pulmonary artery, then it affected here lungs. So any vein it will go to SVC, IVC, from there to left article, from the right ventricle, from there to pulmonary artery, and from there to leads to pulmonary thromboembolism. So whatever vein is there, it leads to pulmonary embolism. So embolus in vein through SVC, IVC, left article, left ventricle, pulmonary artery, then pulmonary embolism. Next, importance of embolism: thromboembolism, fat embolism, gas embolism, then amniotic fluid embolism. We will discuss one by one. First, thromboembolism. We already know the detachment thrombus or part of thrombus. This one is the most common embolism, 90 percentage. So out of all embolus is the 90 percentage or thromboembolus, the most common type. What is the most common source? Is T vein thrombosis, DVT. Is DVT leads to embolism is the most common. Second one is fat embolism, from where the fat will come. This is the blood vessels. Okay, in that lumen of that blood, blood vessel, from here fat is coming. Fat embolism, what is the source? They can be two causes. We all have bone marrow. Okay, in this bone marrow, we have two type of bone marrow, red marrow and yellow marrow. Yellow marrow containing fat. Okay, this yellow marrow containing fat. Imagine this person having fracture. Okay, the bone is cracked, there is a fracture of the bone. The fracture of that bone, the yellow marrow is leaking out. Now this yellow marrow is leaking out of that fracture and entering to that blood and forming a fat embolus. So this is how fat embolus is formed by fracture. This is known as traumatic cause. Traumatic cause means because of fracture, the yellow marrow is leaking and coming and forming embolus, moving here and there. Next, second reason, without fracture also sometimes we can see it is presented in the blood. So this is non-traumatic. This can be non-traumatic cause. In the non-traumatic cause like lipid profile. Okay, lipid profile can be altered lipid profile, like in the blood we have LDL, VLDL, chylomicron and all. So if all these are increased, they will accumulated and form fat embolism. So here fat embolism, the fat globules are formed. So the lumen of the blood vessels containing the globules, fat globules. So the blood vessels containing fat globules. So these are the causes: extensive burn, diabetic mellitus condition, fat liver, pancreatitis, sickle cell anemia, then inflammation of bone and soft tissue, extrinsic fat or oil introduced into that body, so hyperlipidemia condition, then cardiopulmonary bypass surgery. These are the way it form fat embolism. So how can identify that fat in blood? By using two special staining, Sudan dye and oil red O. In this Sudan dye, it will give black color to fat. That oil red O, it will producing red color to fat. Next one is amniotic fluid embolism. How does it formed? What is amniotic fluid? Whenever there is a pregnancy, so this one is the pregnancy. Uh, this is the pregnancy in this fetus, inside the pregnant uterus. So the fetus is surrounding, okay, it is surrounding by amniotic membrane. This one is the amniotic membrane, it containing amniotic fluid. So inside it having amniotic fluid. So the fetus are surrounded by the gastro gestational side, the fetus are surrounded by that amniotic fluid. So fetus, that gestational period, that fetus is surrounded by amniotic fluid. Now just suppose it is the time of that labor. Suppose it is the time of that labor, that lady in labor pain, during labor that uterus contract vigorously. Okay, so it contract vigorously, the uterus contract vigorously during labor. So there are tears, that uterus having tears. Okay, uterus having tears. There can be the tears in that myometrium, and this is the umbilical vein. This one is the umbilical vein. And vigorous contraction in this amniotic fluid can enter to, so this fluid will enter to these tears. Then these tears will enter to amniotic this umbilical vein, it will enter to this umbilical vein because of vigorous okay, during labor vigorous contraction, this amniotic fluid will reach to this uterus tears. Along with this uterus tears, this amniotic fluid will reach to this umbilical vein. All the vein will go to where? All the vein will go to SVC and IVC, and finally it reach to that lungs. So the embolus is amniotic fluid embolus. It is a liquid embolus. It will reach to lungs, leading to pulmonary edema. It can lead to sudden death during labor or just after delivery of that mother. So the lady who is absolutely normal, healthy during labor, she died just after delivery. She is died. So what can be cause? The cause can be amniotic fluid embolism. How can identified after that postmortem, that autopsy? Uh, in this case, we will take lungs. Okay, so lung section, we prepare that slide. we can find out. Okay, seriously, it is a unpredictable and unpreventable cause of maternal mortality. So pathogenesis during labor or immediate postmortem due to vigorous contraction of amniotic fluid can enter to uterine vein. So here what is the vein? Uterine vein, and it will reach right side of that heart and causes pulmonary embolism. Last one is gas embolism. How does the gas embolism occur? How that gas is presented in blood vessels? Giving injection to the patient through IV, okay, through intravenous injection. So we give intravenous injection, we filled injection with medicine, whatever the liquid medicine there, and we take the air out. If you have seen first, we take the air out, we take the medicine up to the tip of that needle, then we inject. If we do not take air out, the air also injected, that can causes air embolism. So when air is introduced into venous or arterial circulation during surgery, through vein air enter, during operation of that head and neck, during operation of drama, then obstetrical operation, it can leads to accidental opening of that major vein like jugular vein, and accidental opening of that air, that can happen. Next, venous air embolism. Air embolism can also venous. The venous is dangerous. It is always leads to pulmonary embolism. Head neck surgeon opening the patient, okay, opening operating on the patient by accident, the jugular vein is open so that environmental air will enter inside, it will form that air embolism. Okay, so the air embolism will leave the pulmonary circulation and the patient is suddenly died. Again we will perform that autopsy. In the case also we will take the lungs out. So what do you want to see the lungs? In the fat embolism you look the fat, in amniotic fluid embolism you look that amniotic fluid. How does you see the air? Air is not visible. If you give the cut, it will evaporate, push, go out, like that only. So we cannot capture the air on the slide. To perform autopsy, we take the lungs out, then try to figure out in that pulmonary capillary and take pulmonary capillary. So this one figure out that pulmonary capillaries, and this pulmonary capillary cut under that water. Okay, we will kept under that water. So we will give the cut under the water, bubbles will come out. If that bubbles are coming out in that water, it was air was presented in that pulmonary capillary. How the tire puncture is repaired? Like that, in situ water we can identify this air embolism. This is all about 4 different type of embolism. Thanks for watching.